Well, Cynthia, why don't we talk about our day?
Okay. As tough as it is to hear feedback, the truth is, I don't feel I'm making the progress I want to make with some of my customers. So tell me what to do and I'll do it.
I know you will, Cynthia. In fact, I think that's where you may be having some trouble.
What do you mean?
First, let me say your selling skills are improving, and I'm confident that with some targeted effort, you're going to start seeing better results.
That's good to hear.
When we talked after our last field visit, I told you that I really wanted to see you leverage your clinical knowledge with your customers. As a former nurse, that's clearly where your strengths are.
Isn't that what I did?
Yes and no. There are a number of different areas we could address today, but I think we'll make the most progress if we talk about how improving pre-call planning and investigating might help you. I'd like to address these skills together because I think they really go hand in hand.
Okay.
Cynthia, I saw that you started all your calls with the same opening. If I remember correctly, you said, "I'd like to show you some interesting research on Dolomed, which has been approved for the prevention and treatment of moderate to severe migraine headaches."
I always start with a kind of standard opening, and then I try to align with what the customer says. Sometimes it works really well, like it did with Dr. Kavanaugh, and sometimes it doesn't. That's what I can't figure out. Why does it work well on one call, but then an hour later I do the exact same thing, and that customer gets almost hostile, like Dr. Russell?
You worked for an internist before, right?
Yes, for 8 years.
And when you walked into an exam room, how did you greet the patients?
Usually I said something like, "Tell me what's going on with you today."
And then you listened and observed, correct? Did you ever greet them with a prepared speech like, "Hi, Mr. Smith, let me tell you about some causes of headaches"?
Of course not.
If you had, they might have objected, right? Unless, of course, they happen to be having headaches. And some of them would. So you would occasionally hit your mark. Those patients would then have been really interested. Cynthia, Dr. Kavanaugh was like the patient who happened to have a headache. With him, your planned message hit its mark. With the other two doctors, it didn't. So they voiced their objections. Lots of them.
So you're saying it's like they were complaining of stomach pain, but I gave them medicine for a headache. You know, I've been trying so hard to think like a salesperson, I forgot that sometimes it might be okay to think like a nurse. I guess the roles have some similarities.
Well, the way to succeed in either role is to help your customer, so to speak. And Cynthia, try to think holistically. Just as you would consider the whole patient, you now need to consider the whole practice. The practice's needs may be in the area of patient outcomes, but they may also be in an entirely different area. For example, Dr. Russell was concerned about reimbursement. You did the right thing by providing him the toll-free number to address his concerns, but then you should have gone on to ask him additional questions and address any other concerns he might have had. Dr. Parker was concerned that her staff may not want to train patients to use auto-injectors. Why is that? See what you can find out. Do they need an in-service? You won't know until you ask them questions. What are your thoughts?
You know, I think I rely on my clinical background when I get nervous. And I'm kind of thinking out loud here, but maybe if I do what you're saying, really do my homework and ask more high-impact questions, I'll go in with more confidence.
I think you're right. So here's what I want you to do. Plan your next calls with Drs. Parker and Russell, using the continuous call plan format you learned in training. Think about what they said on this last call and what needs they revealed. Develop a string of high-impact questions to gather more information. Make sure you go beyond patient-centered questions when appropriate. Also, make sure you've done your research so you can handle objections. Not just clinical objections, but other objections too. Then, you and I are going to role-play the calls. This way, when you walk in the next time, you'll be confident and fully prepared. If we role-play this Friday, does that give you enough time to prepare?
Yes.
Do you have any questions about what I've said?
I think it's clear.
Great. Cynthia, you've come a long way in a short time. Improvement in these areas should move you closer to where you want to be.
Thanks, Linda.